extend. Sorry, semispinalis. Innervation for all of these deep muscles of the back, if you recall, are dorsal rami. So because these are at the neck level, their nerves are going to be the cervical dorsal rami. They don't form a plexus, and we don't name any more specific than that. Layering over, so the next layer, superficial to the splenius capitis. Superficial to semispinalis is splenius capitis. So semispinalis is almost straight up and down. Splenius capitis is at an angle. So it forms a V. So we can just barely see some of the fibers of semispinalis as they appear deep to splenius capitis. So on this torso, show it to the back and then I'll rotate it around so the front can see better. Here would be semispinalis, and coming in this direction, joining with the other side to form a V would be splenius capitis. Because of that V, its insertion is more lateral, or because it's more lateral, it forms the V. So it also includes its insertion on the mastoid process. So we have sternocleidomastoid going this direction, splenius capitis going that direction, but both of them will function to turn the head from side to side. One grabbing the mastoid process from the front and turning it, the other grabbing the mastoid process from the back and turning it. So the green is going to be splenius capitis. Splenius capitis and sternocleidomastoid can be described as having a relationship that's both synergistic and antagonistic. So turning the head from side to side, they're sharing the same function, so they are synergistic to each other. Sternocleidomastoid flexes the cervical vertebra. Splenius capitis extends the cervical vertebra. So in that movement, they have the opposite function, so they are antagonistic. You just have to look at what the movement is. When they do the same function, they're synergistic. When they do the opposite function, they're antagonistic.
What's the opposite of extend?
Flex.
Can you say that antagonistic part again?
All right, so splenius capitis is going to be synergistic with sternocleidomastoid, or the function of turning the head from side to side. Okay, it's going to be antagonistic with the sternocleidomastoid movement, because sternocleidomastoid flexes cervical vertebra. Splenius capitis extends. Remember, flexion was decreasing the angle of the joint. Extension is increasing the angle of the joint. So if our vertebral column is at the straight line, it's 180 degrees. We flex it, we bend it, we extend it, we straighten it out. Now the next set of muscles that I want to look at are the rotatories and the levatories costarum. And these are these muscles here. I actually brought in this guy is, so which of these torsals would you say has oxidative muscle fibers and which one has glycolytic muscle fibers? Remember the difference in the appearance when we talked about glycolytic versus oxidative muscle?
Oxidative
The dark?
there.
Yeah, with all the myoglobin and stuff. Okay, so this guy's build is oxidative. He's not quite as dark over here, so more glycolytic. They're both, obviously, neither, but just to recall that information. So if you look at the back, these are really deep muscles that are found just, they're even deeper than our, what are called deep muscles. These are found within the transverse and spinous processes angle of the vertebra. And so rotatories are going to go between transverse process and spinous process of the vertebra, and they do what the name says, they rotate. Right? So this is the only model that shows those, but you can see them up here on the diagram. So rotatories between the spinous and transverse processes. And let me add some ribs in here so I can talk about those as well. We're not going to give these guys enough numbers for vertebrae in his neck. I'm just going to choose ribs here. In case you can't figure it out. All right, so those would be the rotatories. Notice they don't attach to the ribs. And they're going to rotate. They're going to insert onto each vertebrae and twist it. So we have rotation. And then the levatories costarum come off the transverse processes and go to the ribs. Hence the inclusion of costa, or costal facets, or costal joints, or vertebral components. So these are the levatories, meaning they lift up the ribs. And you don't have to worry about the innervation for these because they're also dorsal rami, just these really, really deep muscles. So on the torsal model here, again, you can see that these are going out to the ribs rather than just to the vertebra. So these would be the levatories costarum. And the more shorter ones are the rotatories. The next set of muscles are these muscles that you see right here and in this diagram here. They start out as a huge, thick bundle of muscles that are cut in this diagram right here. So you're not seeing the individual ones, but they're a big column. If you look at images of bodybuilders, you can find a large column of muscle just above the buttocks on each side. On this torso here, it's covered by fascia, but it would be, you would see that large component right here. And then we really can't see it on this side because it's covered up by the superficial muscles. But over here, this whole level that you're seeing there and here are identified as this group, the erector spinae. So as a group, they're called the erector spinae. But as we move up onto the posterior chest wall, they separate into three separate components. So I'm going to draw them on this side. Oh, I don't have ribs that high. And they arise from a common fascia, and they're long, 6 to 8 inches long, and they overlap. They form this series of overlapping components. So you don't have to identify, this is not an upper division anatomy course, so you don't have to identify the individual attachments for the three subgroups. The most lateral group, however, inserts onto the ribs, and then has its origins from ribs and inserts onto ribs. The medial group runs along the transverse processes of the vertebrae, actually goes all the way up to the head, and then the most medial group runs along the spine. And that's how you can differentiate. The most lateral group is going to go rib to rib, and overlap. So that most lateral group is known as the iliocostalis. From the iliac crest to the ribs. The more medial group runs closer to the vertebra, and then the midline group runs between vertebra and vertebra on a more midline level. So this gives us the longissimus, and finally, right along the spine, spinalis. So again, the most lateral is attached to the ribs. That gives us costalis, costa again. Spinalis is right along the spine, and then longissimus is in between. So down here, where you can't differentiate between them, I would just want you to identify it as erector spinae. Up higher, where you can see the three separate groups, iliocostalis, longissimus, and spinalis. So the three of these groups are identified as erector spinae, and they do what their name says. They extend the vertebral column. Again, innervation, dorsal rami, depending on which level. So if we're looking at erector spinae in the neck, it'd be cervical dorsal rami. If we're looking at erector spinae in the lower back, it'd be lumbar dorsal rami, and that's as picky as we get. All right, the last deep muscle of the back that we're going to look at runs up and down between the iliac crest and the floating ribs, the vertebral ribs, and it's named for its shape, which is that of a quadrangle. So it's this muscle right here. So it's running between the iliac crest and the transverse processes and vertebral ribs. You can see a little bit of it here, and then in this diagram, it's shown here. That's not a muscle that you can see from the posterior view. It's a muscle that you have to look at from inside the posterior cavity. So here's the iliac crest, and this quadrangular shaped muscle right here is quadratus lumborum. Okay, so right here, right here. That muscle can be used to flex the vertebral column. It's also used, as you can see here, it's also used when you walk to keep the opposite side of the hip from dropping. So to maintain the iliac crest parallel as you walk. So it doesn't drop down because you're not having the support of the lower limb. So I'll draw that in as a green muscle. Quadratus lumborum. So along with the muscles of the face and the chewing muscles that we talked about yesterday, those are the ones that we'll have the lab quiz on Tuesday. So muscles yesterday, facial muscles and muscles of mastication. And the muscles today from the tongue and the floor of the mouth, and then these deep back muscles are what the quiz will be on Tuesday. We're going to take about an hour break, and then we'll come back and talk about the superficial back muscles, such as the trapezius. There's about 4 of them, 4 or 5 that we'll cover. Okay?
Yeah, I think that's nice since we're ready to do that.
Right. Correct. Okay.